It's another beautiful day. Welcome to MERRO-X TV. This is the Mirror Time. My name is Freda. Today we actually going to look at our focus on the health sector, especially for our newborn babies, the infants. I mean, there are certain things that we must know as a parent you have to do to give that child a healthy living lifestyle. Well, today we are so privileged and very happy joining us here on the Mirror Time. That is Dr. Mrs. Eisinam Pediatrician. I mean, we're going to talk about a lot of things that as a parent you have to know. But before that, we want to acknowledge our sponsors, Jome Clothing. Isi and Sunyane have been looking for good things to buy dresses for engagement, wedding, children dresses, and then men and women garments as well. Your batakari, you have to get some, and then have a few. You can also pass by and do some window shopping. Yeah, my group just pass by, like checking something. Then, you just plan something for that special person. Locate them at Utia Boahe in Abyssine off in Crankbone Road. Opposite St. James Clinic, that's where you locate them. Find them on social media as well. You can call them on 054-1918-038 or 054-74-68518 as well. We'll be back for more. Don't go away. Welcome back to MERRO-X TV. This is the Mirror Time. So as I told you earlier, I'm very privileged to have an amazing woman of God, and of course, the was medical professional doctor, Dr. Mrs. Eisinam Pediatrician, and of course, she's a pediatrician. Today we're gonna find it out. You know the way I'm pronouncing that thing. If you don't take care, you mess it up. They have a duty in the role to play for newborn babies as well. So they get to certain stages. But today we're gonna find it out. Something little about her too. You don't want to miss that. Mommy, good to see you.
Good to see you too.
How are you doing?
I'm blessed.
Wow.
And you?
I'm blessed too. You're looking good. And your office too. Now, I wish I was sleepier. So that Kindle comes. How is everything?
Oh my gosh.
The family and then what? How do you combine your family and then your profession? How do you do it?
I think God gives me the strength to be able to do that. And I think the other thing is when you have a supporting husband, it's also very, very helpful. And it's something I love to do. So when you love to do something, you usually do not struggle that much to do it. But I know God has been.
Well, I love the supporting husband part. I think it's very necessary too. To look at those angles, not to stress yourself, because you know that even if you're not there, there's a replacement. That's really cool. Just want to know, do you know people think you cannot speak Tree at all?
Oh, I speak
it's very, you proved them wrong. You proved them wrong. Yeah.
Wow.
You proved them wrong. Is it true? Oh,
I speak good Chi.
Okay. Oh, I speak good Chi. Yeah, that's good. Doc, let's talk about something little about your profession. Not the family aspect, but about your profession, how it all started for you.
For me, I think from childhood, I'll say around GSS, I just knew that I wanted to be a doctor.
Wow. How?
I don't know, I just knew.
Wow.
And it's something that I've always, it's the profession I've always admired. Okay. And the fact that you get to help people who are vulnerable, because when everyone is ill, they're in a vulnerable state, and once you're able to help them, they come back on their feet. I believe that that's very, very rewarding, and it makes me very happy.
Wow. So was there any motivation attached to what really motivated you
to? Growing up, I had allergies.
Okay.
So most of the time, like I had a cold, had to be in the hospital. I think it was this day that's like you kept going in and out of the hospital. It's like allergies. No one is really figuring out that it's allergies. And then we met this doctor, and my mom starts speaking, and then he just knows that it's allergies, and then that's the end of the story.
Oh,
Because to be able to help someone who is ill, you need to be able to diagnose appropriately, and then once you have your diagnosis, then you can manage appropriately.
wow.
The person doesn't have to go in and out. So that
Wow.
was the part. But like, okay,
Oh, okay. I'm so interested in that.
I know, right?
Wow. And where the children aspect attached to it.
So usually after during the training, we're allowed to go to all the various departments. So we do internal medicine, that's for the adults. We do surgery, we do pediatrics, we do ONG as well. So whilst you're doing the rotation, I think it's also to help us know a bit about every department, be able to manage like generally all conditions. But for me, I was also looking out for where I'm interested in, like where I want to narrow down to. And I realized that there's something about the children that just gets me excited. Like when I see the kids, it's just they're just such a blessing.
Wow. I see.
They're very genuine as well.
Oh,
So
I like that
if
part.
the child is ill, they are ill.
Okay.
Like, and when they are well, they are
Yeah,
well.
well.
Unlike adults,
So,
when they are well, like,
we know
they're good,
ourselves.
yeah.
They know
My
us.
kids are so genuine and they're happy. And there's nothing as thrilling as you help a child to get back on their feet. They're happy. They come for review at the clinic, and they just see you and just run to you and give you a hug.
Wow.
It's just amazing.
Wow. And so then, I mean, one will ask, who is a pediatric person or a pediatrician?
Pediatrician. So a pediatrician is a doctor who has been trained to take care of children. Okay, so from the newborn right down to, depending on which country you're in, up to 18 years. Some will say 16 years. The pediatrician is just a doctor who's trained to take care of all medical conditions.
Oh, wow.
for
Oh, you are
children.
all
But medical, not surgical.
Oh, okay. So is there a point where, I mean, you are done maybe at the age of 5, there's a different doctor who will take care of them, or there's a particular age that.
So we have so the pediatrician is sort of the general, so someone who takes care of children. And in the pediatric field as well, we also have we call it subspecialties. Okay, so we have the neonatologist, and the neonatologist is someone who takes care of just newborn babies.
Okay.
So between like the newborn, they just be delivered to about 28 days. Some may stretch to about 2 months, and then they are just specialized with the newborn. And then we have pediatricians too who are subspecialized in different areas. So we have someone who is subspecialized in the heart. So there's a pediatric cardiologist. So they just take care of children who have heart conditions. We have the gastroenterologist who takes care of children who have GI issues. So the jaundice, any problem with the liver or with the intestines, they usually will take care of that. We have pediatricians who are specialized to take care of the children with kidney problems as a nephrologist.
Wow.
So basically,
I mean, this is my calling. I mean, this is my job. There's no way you are giving me like the whole world to be a medical doctor. Nah, that's not my field. Wow. The words, I mean, the terms, and the passion that you are using it to. So I can feel like it's actually your passion. It's not something that, I mean, everybody was doing it, so I want to also follow it.
Not at all.
So how long have you been in practice?
More than 10 years, actually.
Wow, where was I? 10 years. Wow. And would you say, wow, and would you say you've achieved your mission and vision of your field as a pediatrician?
As a pediatrician, I mean, I've had some achievements, but I believe that there's more to be done, especially for the children, especially in our setting. There's more to be done, and there are higher achievements to achieve.
Okay. So now, I'm sure you do experience the newborn baby, some
I
of the
do.
things that. Let's talk about. We get cases, a newborn baby is out, there's a hole in her. A newborn baby is out, and there's this brain tumor and all that. What do you think are the causes for these things to happen?
Mhm. So the thing with the newborn babies that they go through in the womb, they develop. You understand? So they start from a point and then they develop. And as they are developing, things are supposed to happen such that the structures in the body form well. Sometimes if you have anything that disrupts this development, and that's where you have the issues or the issues when they are delivered. The interesting thing about the newborn baby is that it will surprise you to know that to be able to, all these issues actually start from preconception.
Okay.
So to be able to take care of these things, make sure that the child is developing well, there are no issues. It actually starts from preconception. Preconception just means that before the child is even conceived.
Yeah.
Okay. First of all, you have to plan for it. Okay, so we have instances where people do not plan for the babies, taking all sorts of things to terminate. So the medications as well are going to affect the babies. If they come out, you may have all sorts of things because the medications are going to disrupt the development of the baby. There are other medications too that you need to even start taking before conception, like the folic acid, because it's been noted that this also helps, especially to prevent children having brain and then spinal cord issues.
Okay.
So that's it about the newborn. So
Well, it just occurred to me that I think education with that angle. Do you think the society has embraced that, knowing these things before, get pregnant and other stuff, things, medication you have to take and go into, some don't even go to antenatal, and all these things. And we say some of them, they cause majority of,
Okay.
of the
I
child.
think education is our biggest challenge. Okay, we've handled so many things, but education is our biggest challenge, and most of it has to do with our culture as well. So, for instance, most people believe that when you're pregnant, like until you're gone past 3 months, you do not go to ANC or you do not go to the hospital. Okay, because of so many beliefs. If you go early, there are so many beliefs. You will be surprised some of the reasons. But that's the cultural aspect that actually hinders the infants. Okay.
Oh, wow. I see. There is a lot for us to learn for the
That's
newborn babies. Has there been any case that you like, this case, I don't think the child or the baby will survive? Or, you do all your best, with all the scientific things, researching, and then the child couldn't make it. Have you experienced cases like that before?
several
Wow.
several cases when it comes to the newborn. But I choose to focus on the ones that do surprise you.
The miracle.
The miracle ones, like they are the ones who surprise you. You have a child coming out, is not breathing, is not doing so well, but you intervene and then this child starts breathing and then they go home and then they're growing well.
Wow.
And those are very, the ones that I choose to focus on. There are few that come in with, most of the time, if they have any congenital malformations, so say they didn't, for some reason, they didn't go well, or some parts of the body did not develop well, or they came out too early, before 28 weeks. Those ones tend to be very dicey. Their ability to live outside the womb also is very challenging. So most of the time, that cases becomes very challenging because then you need to put everything and you're just counting on the child just pulling through. Yeah, but some do surprise us. I've had a 25 weeker doing well, and then we were able to discharge weights about 0.5 kg.
Wow.
So,
Wow.
and we do well too. So some do surprise
Okay.
us, but yeah,
Will you say the
quite a
others
number
do?
too.
Okay, the
Yeah.
others too. Will you say we are disappointed losing some of the babies?
Disappointed, no, because sometimes it's just out of your hands.
Okay.
Yes, especially for I keep mentioning the congenital malformation. So if say they have a problem with the heart, for instance, and it's not one that is compatible with life,
Okay.
then that one you definitely know that you're going to lose that child. And there's really nothing you can
Do about it.
Yeah.
But has there been any circumstances where you try your best, the surgery, everything was perfect, and within some few days the child is normal? Have you experienced that one too? Because
Yes,
we do hear cases like that too.
Mm.
They'll come out seeking for support, and then the next week or two the child
The
is
child
normal, and like they spend a lot of money. So could you explain that portion too? Sometimes what do you really happen?
So I think sometimes, depending on what the problem is, it's very difficult for some parents to accept that this is what it is. It's very difficult. We can't do anything about it. Even if we do something about it, it's just to prolong life for a bit, and we are going to lose this child. Sometimes we have such situations. We try to counsel and then talk to the parents about it, but it's difficult for a parent to let go. You understand? It's a very dicey, very dicey situation. Some would rather they put their all, make sure that they've done, what they can do for the child, and then they hope for the best. And in that case, it's difficult to say, oh no, don't put in your best for the child. But we will just advise you, give you the facts on the ground, and then usually the parents would have to make the decision. But whatever the decision is, we still support.
Oh, okay,
Support.
that's good.
Yeah.
So how do you detect like, okay, this child is suffering from this when they are crying? Sometimes I've had experience. I remember a cousin of mine crying, and I don't even know what is wrong with him. We go to the hospital and like, yeah, this is wrong. I mean, he's okay, infections and all that. I mean, how do they attach all these infections? I mean,
They should like come to like so.
and they'll be crying.
Well,
And you
they'll be
don't even know what to do.
I think it comes with the training as well.
Okay.
Yeah. So if probably you get to see a lot of children, and our training is such that so most of the time when you go to the hospital, we do ask a lot of questions.
Yeah.
Yeah. So what did you do? And then we ask specific questions. Okay, is there fever? When did it start? How did it start? How did this progress? That helps us. We call it a history. Okay. So most of the time, by the time we finish talking to you to figure out what is happening, how long it's been happening, what has been done, and all that, we have an idea of what it can be. Okay. And then the next step is to examine the child. So most of the child, that's where the difference between the baby, the older child, and then the adult comes in. But for most of the children, like just observing them, you can be able to tell a lot.
Oh, okay. Really?
Just by observing
The kind alone.
the crying, even the cry, sometimes it's helpful. How the cry sounds even may tell you the child is even having a seizure or not. So how is the child crying? Even the facial expression when the child is crying, sometimes we have some deviations, we have so just observing the child. Sometimes you're looking at the child, you realize, the child is not raising this hand.
Okay.
Then then there's a problem with the hand, so you narrow down. So that's what makes it very interesting. So just by looking at the child, you're able to tell a lot. Even before we put a stethoscope or even touch the baby, we're able to tell a lot what is going on.
Wow, this is so amazing and interesting. We're having a conversation with Dr. Mrs. Eisinam Pediatrician, who is a pediatrician, of course. And I mean, I wish I'm still a baby, so that's experience those things and the injection pad, the syringe, and all that. So now I'm even afraid when I see syringe and all that running away. I don't know why, but we'll be wrapping up very soon. But can you take us through the process where a mother will pay much attention to the baby to develop a healthy living lifestyle.
Lifestyle. Sure. So, like I said, the process actually starts before pregnancy. Okay, and I mentioned earlier the planning for the pregnancy is very important. So the family planning. I mean, you know that the child would require certain things. Okay, including time.
Okay.
So you need to plan for the every pregnancy. Okay, so that then you make sure that whilst you're going through the pregnancy, everything that you need is gathered. So when you deliver, the child has what the child needs. The other thing too is starting medication. Okay, so at least the folic acid even before pregnancy. So you realize that elsewhere, even when they are planning for the pregnancy, they actually see the obstetrician. Yes, but that is not in our setting. Most people don't even want to go to the hospital until they are above 3 months. But that is one of our major problems. Now, when you conceive as well, it's very important that you book early. So, as in, go to the ANC, the antenatal clinic, as early as possible. So when you realize you've missed your menses, that is the time to actually go to for ANC, because we do some labs as well, which also helps us in planning for the baby. Some mothers may have some infection for which they need to the child needs some medications after delivery. So if you don't know that, then it becomes a problem. Some may have some defects that once we know some medications to avoid, like just speeding, so it doesn't harm the mother or the baby as well. And then we know what to look out for when the child is also born. And like I said, once you know what you expect, then it's easier to anticipate it. Then you look for it early before it becomes a problem. Now, it's very important to have an early scan. So if you say report late, then you don't have that early scan. Most people don't even remember their last menses. So then even dating the pregnancy becomes a problem. Meanwhile, when you start early, you have an early scan, it's easier for us to be able to accurately date the pregnancy, and that also helps us in the delivery. So we realize that if you're not able to date the pregnancy well, you're not able to tell if it's post date, like you've gone beyond your time. Once you go beyond your time, so the placenta can come off, that affects the baby. Or if you deliver before your time, because sometimes we may have to deliver before your time. Right? If your pregnancy is not dated well, that becomes an issue. The other thing too is the medications during the pregnancy. So during the pregnancy, you're given some medications. Your blood level needs to be at an appreciable point. Remember that everything that affects the mother affects the baby, invariably. So if you realize that mother is ill during the pregnancy, you need to report as early as possible, because something as little as malaria in the mother could cause the baby to come out too early as a preterm. Yes, and then you could have some infections too that would affect the baby during delivery. So during the pregnancy, any concern at all, you need to report it, because everything that affects the mother affects the baby. The same is nutrition. Sometimes you realize that during the pregnancy, if you're not eating well, that also affects the baby, because the baby needs to grow. In the development, the baby needs certain building blocks to be able to grow. So your protein intake, everything you're taking, the energy, everything the baby needs, and it needs to be in the right proportions. Okay, because it's what you have taken is what the child is taking invariably. Yeah, I'm not sure what is happening now, but there are some mothers who have decided to be dieting whilst they are pregnant or whilst they are breastfeeding, which it's not supposed to be so, because whatever is going in is what the baby is taking invariably. So if you're not eating healthy, then the baby is also not getting good nutrition, and then they come out and they're not doing too well.
Wow.
It's a whole lot. So even during the pregnancy, and then the other thing is during delivery. So once the delivery has to be planned first of all, because when you're getting close to the time, usually if you go to the hospital, we examine you We're able to tell what the baby's weight is. So if the baby's weight is too much, then sometimes depending on the mother's um, build, you may not be able to deliver via CS. So you may not be able to deliver vaginally. So then we need to plan for a CS. So that all happens within it because realize that the baby is too big and you go into labor and the baby is not coming out and then you have to do all so many things. You realize that this baby is born and is not breathing, and that is a big problem. Okay, and affects the brain, even the development of the child becomes a problem. So every stage is very important. So and I think education also needs to go far. You realize that some even go into labor and then they don't report to the labor ward early because then they want to, as soon as they get there, they deliver. As you see, during the pregnancy, even how the child is lying is very important because sometimes the head may be down, but the child may be tilted a bit. So you realize that delivering the child vaginally is not an option. But if you stay at home and you wait till like 9 cm and then you come, then they have to forcibly deliver the child vaginally, and that's going to affect the child's health as well. So everything affects the baby invariably. And then once the child is delivered, you need to look out for certain things. We tell you jaundice, the child's color. We schedule visits after the child is delivered. So you need to follow that as well because then there are things that we'll pick up very early. And once we pick it up early, it helps. So if the child is jaundiced, many people would give so many things to do when the child is jaundiced. Jaundice just means that the eyes or the skin is yellow. Now, as trivial as that may seem, sometimes it is a disease condition that is causing the jaundice. And then if these levels, these things in the blood that cause the jaundice are too high, it actually affects the child's brain. And then that affects the development as well. To realize that a child at some point is not going, time is supposed to sit, is not sitting, is not able to walk. But if you come early, you look out for these things, we also look out for these things and we see the jaundice early, then we have what to do to be sure that the brain is intact and the child does very well.
Wow. Thank God I have a pediatrician. So I'm safe. For me, I am safe. Wow, that's a very insightful process. And like you say, I was just thinking about people in the epic areas. How did they don't even know all these things. And most of the time, so they like, yeah, let me give this medicine. My grandmom said, I mean, I have to take this local, herbs
said
and
so
all
many
that.
things.
Okay. Do you experience those? Maybe a parent will come like, no, we don't like this medicine. We want to go and take
Oh
this
yes,
local.
most of the time, even the cord itself, even handling of the cord. Ideally, if you don't even apply anything, after 7 days or before 7 days, the cord falls off. But in our culture, we want the cord to fall off immediately. So people apply so many things. There's cow dung, there's toothpaste, there's Maggi, all sorts of things just around the cord, and they come out with infections. And that's a problem. And then even the herbs, some will come, some of the herbs they even put in the nose, they put some in the anus, they bath the children with it, and it's all coming with bad infections, which are very avoidable.
Wow. I see. We talking about equipment and your sectors. Sometimes we do hear, appealing to the public. You need this. Sometimes government will try to bring other things, which you think that if they have to upgrade it, it will help in producing a good results for the institution and the babies as well. Do you think you have enough equipment that actually satisfy the baby's health in your institution?
So now I think thankfully for the senior teaching hospital, we had a program that's MEPSI 2. So this is Kibeli is so there are NGOs from outside who came in, did an assessment, and then they actually brought in a lot of equipment. So for now, we've actually expanded our NICU to take the whole block, and we have the equipment there. Yeah, I mean, you can never have enough. If we have like 2 blocks of equipment because you have the babies just coming in. But I think some effort has been put in place to ensure that we have equipment we need to be able to deliver quality care to the babies. Yes. But the issue is that, I mean, if a baby comes to you and it's too late, no matter the equipment you have, it is too late.
Okay.
You understand? So that's why I keep hammering on the education and then the prevention. Okay, if you come early, we have all the equipment to ensure that the child is doing well. But if you come in late, then all the equipments there are really not going to help. For instance, if it's jaundice and it's gone into the brain, then when you come really, there's not much we can do because then the damage to the brain is done. However, if you come early, we have the phototherapy to make sure that the jaundice goes down as quickly as possible. So I think it's education, 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 report early. If you notice anything that just baffles you, report early. And it starts as early as before conception, through the pregnancy. Everything that happens through the pregnancy affects the child, and delivery also affects the child as well.
Well, before we go, like your take on exclusive breastfeeding. I mean, I'm sure there's been a lot of debatable stuff. I mean, what's your take on that? I mean,
There's only one thing. There's only one thing that is the best, and that's breast milk. Exclusive breastfeeding is the way to go.
Okay.
I mean, you pick the formula and it's even written on every time I show it to them. The formula container, they've written on it, breast milk is the best. So it's just like having a cigarette and they've written cigarette causes cancer and then you're still going for it. So that's basically how I see it.
Okay.
So if you have something that is, you're trying as much as possible to manufacture something that is close to the original, which is breast milk. But as much as you try, I mean, breast milk is what God has done. Yes, human milk for human beings. Cow milk.
Exclusive breastfeeding.
Exclusive. And for 6 months. I mean, you have someone for 4 months, you want, and so no, it's not too much, it's not enough, the child is not sick. That is not true. If you have triplets, you can breastfeed each of them. The thing with breast milk is demand and supply. So as soon as the child is breastfeeding, the milk would come.
Wow.
And there's demand and supply. So if you have 3 babies, they would have enough. And you have enough for all of them, so far as you're putting them to the breast. The thing about the breast, I think sometimes we also fail in explaining why we are saying exclusive breastfeeding. It's one thing to just tell someone, breastfeed exclusively and then leave it there. But when you explain it to the person and the person knows why, the reason we would say exclusively breastfeed for 6 months is that before age 6 months, the children are not able to form, like their immunity is not optimum.
Okay.
So they're not able to fight infection as we would, because we have antibodies and everything that help us fight infection. But the babies are now developing that. So before age 6 months, they don't have that. So then they rely on mothers' soldiers. Let me put it that way. So the mother's antibodies to protect them. So you realize that's something they don't have. So if they're getting it from the breast milk, the more the better. So then you're able to protect them throughout the 6 months till they start producing their antibodies to fight infection. So that's why the cut of the 6 months.
Wow.
But then after 6 months, you just introduce other feeds, but you continue with the breastfeeding, because there's a lot of goodies in the breast milk.
Just feeding them Banku 6 months.
6 months.
Hey guys, you're killing them all. Wow. Thank you, Doc, for your time. Really, I appreciate it. I mean, we've learned a lot. I mean, there's going to be a part 2 of this conversation. I'm looking forward for that. There should be a part 2 for this conversation. I mean, we live in your final advice to a mother who's, watching us, and maybe certain things that a trick that probably will touch a mother's heart, like, hey, this message there, I have to pay attention and protect my child. You know, most of the time they are too confused, be like, why should I do this? So the education is really expanded. I mean, to get inside in what they are doing. A short message for mothers.
I think you're talking to mothers. There's one thing that I keep saying, like for every mother you're talking to, there's no one who loves their baby more than they do. And there's no one who wants the best for the baby than the mothers. But sometimes it's the education. I mean, what you know is what you're going to do. Okay. But when you have good information, then you have something, good knowledge to build, to hold on, and then be able to do the best for the child. So what I'll say is, I mean, the babies will say that the babies are the most vulnerable when it comes to society, and they need they are dependent on us. Okay, so then we need good information, good knowledge to be able to do our best, which we want to do for the babies. So as much as possible, where we get information from, the source should be credible. So we use that information in making decisions for the babies who are vulnerable.
Wow. Thank you so much, Doc, for your time. Really appreciate it. It means a lot to me. And God bless you so much.
Amen. God
Wow.
bless you too.
Wow, so that was Dr. Mrs. Eisinam Pediatrician, and of course, the First Lady of All Salvation Ministries. I forgot to mention that. And a medical doctor, a pediatrician as well. I mean, before we wrap it up, I just want to say a very big thanks to Cage Mill Metal Works. Anything metal, I mean, look up for them for your tables, your chairs, the canopies, I mean, iron gates. I mean, you can also talk about the sliding gates and all kinds of metal works. I mean, get in touch with them. Call them on 04535887773 or 02041660003. My name is Frida. Before we go, please, the winning check team in the whole world is World Salvation Ministries. They're inviting you for their early morning prayers, which is on Monday to Saturday, 5:30 a.m. to 6:30 a.m. Come and meet the General, Bishop Collins Nyako, the founder. And then on Tuesdays and Fridays, it's their non-denominational services. But before that, you'll have an encounter with the man of God, 3 p.m. to 5 p.m. It's called Meet the Prophet. And then after that, 5 p.m. service starts to 7:45 p.m. The same thing applies on Tuesday as well. And on Sundays, their Divine Encounter service, don't forget to join them, 6:30 a.m. to 10:30 a.m. And in the evening, Strictly Prophetic is called Exodus R from 5 p.m. to 7:45 p.m. What are you waiting for? Join the winning team church here in Sunyani opposite St. James Seminary Senior High School, and let God touch your heart with the General, Bishop Collins Nyako. My name is Frida. This has been an amazing journey with Dr. Mrs. Eisinam Nyako. Enjoy the rest of our programs. Have a good day.